I'm doing my IV push. The first thing I want to do is compare my doctor's order to my MAR. I'm looking for the right time, the right route, the right amount of medication, the right medication, and that I have the right patient. And today we're going to be given Lanoxin, which is digoxin, 0.2 milligrams, and we're going to be giving that dose now to our pediatric patient. I also want to check and make sure that my patient doesn't have any allergies, so I want to check that in the computer. I want to check that on my MAR and against my order and make sure they're not allergic to the medication that we're given. I've already worked my drug problem, and I'm going to be given 2 mLs of digoxin, and I'm going to be giving this over 5 minutes. So while I'm holding this, I'm going to go ahead and pick up my medication, and I'm going to compare my medication to my MAR. So I'm making sure I have the right medication, and I'm also making sure that my medication is not expired. So I'm checking the expiration date, and the expiration date is 1 year from now, so we're good to use this medication. All right, now that I've done that, I can set these aside, and I want to read about digoxin. And it says, for safe dose, it says 2.4 to 3.6 micrograms per kilogram per day, given once daily. Doses may be adjusted every 2 weeks according to clinical response, serum drug levels, and toxicity. And then for dilution, it says it may be given undiluted, which is how we're going to give it today. Or it says each 1 milliliter may be diluted in 4 milliliters of sterile water, normal saline, or D5W. So we have D5W hanging, so we know that it is compatible with what we have hanging, so we can use it to flush. The rate of administration of this medication, it says each single dose needs to be given over a minimum of 5 minutes. And then some precautions we want to use: avoid in patients with heart failure. And then you also want to monitor closely for signs and symptoms of digoxin toxicity. So the dig level is 0.5 to 2. And some signs of that are anorexia, nausea, vomiting, vision changes, and cardiac arrhythmias. And that we also want to make sure to check the apical heart rate before we administer this medication. The apical heart rate must be over 60 beats per minute before we administer this medication. And one more thing about, since we're giving it to a pediatric patient, it says the earliest and most frequent manifestation of dig toxicity in infants and children is the appearance of cardiac arrhythmias, including sinus bradycardia. So you want to make sure to put an EKG monitor on your pediatric patients. All right, so now that I've read about my medication, I know about my medication, I know I have all the safe dosage and that my fluids are compatible, I am ready to start preparing my equipment. So the first thing I want to do is wash my hands. And I'm going to open my syringe, and my syringe already has my blunt needle on it. Okay, I still have the cap on. Okay, next I'm going to get my medication. It's already open. I'm going to clean the top. For 15 to 30 seconds. Making sure not to touch that again because it is sterile. I want to pull up my 2 mLs of air. And inject my air. Just scoop my cover back on and check for any air bubbles. That's one tiny little air bubble. Got it. Right, then I have 2 mLs of my medication. I have an air bubble over here. 2 mLs of medication. Right, the next thing I want to do is label my syringe, because we are in the nurse's station. So on my label, I want to put my patient's initials. I want to put the drug, so I'm going to put Lanoxin. And the amount is 0.2 milligrams. Prepared date, 10/21. The time, which is 1 o'clock, 1300. Prepared by, and my initials. And I want to put this label on my syringe. Alright. So now I have my medication prepared, and I am ready to go to my patient's room. So to my patient's room, I need to take my medication, alcohol pads, and my MAR. Right, I am in my patient's room, and first thing I want to do is, can you tell me your name and your date of birth? And as they tell me their name and date of birth, I'm comparing that with their armband as my 2 identifiers. I also want to ask my patient if they have any allergies, specifically to digoxin. And then I want to explain my procedure. I want to explain that the doctor has ordered for digoxin to be given, and this is an IV push medication. It requires no additional needle sticks. We are going to be administering this medication through your existing IV. I'll be administering over 5 minutes, so I'll be standing here with you the whole time. I'll be monitoring for any signs and symptoms, any adverse reactions, and I'll also be teaching my patient about any adverse reactions while I'm here as well. Okay. I want to wash my hands before touching my patient. And now I want to check the arm. I want to check the IV site. I want to make sure there's no redness, no swelling, no leaking fluids. Make sure they're not asking them, make sure they're not having any pain around their IV site, and they're not having any pain. So then I want to check and make sure I have a patent IV by lowering the bag. So I lowered the bag above the level of the arm. And if I have blood return, which I did, it is a patent IV. And I also want to make sure, I'm not sure if I said this or not, but I want to make sure to ask my patient if they have any allergies. Even though we read that on their chart and on the MAR, we want to make sure to ask them that as well, just to restate that they do not have any allergies. Okay, next I want to identify the port that I'm going to be using for medication administration. And the port that we're going to be using is the port that's closest to the patient, and that would be this one. So I want to clean my port. Okay. And I want to take off my needle, since this is a needleless push, and attach my syringe. And I'm going to be giving these 2 mLs over 5 minutes, so that is 0.4 mLs per minute. So while I'm administering the medicine, I'm going to clamp off behind, and then whenever I stop, I will open it up and let it flush through. Okay. So I'm going to start on 12, which is now. I'm going to administer 1, 2, 3, and 4. Okay, then I'll let it open up and flush the medication. Alright, and I'm back at 12. So I will clamp off behind, and I'll push another 0.4. 1, 2, 3, and 4. And I'll open it up and let it flush. Okay, I'm back at 12, so I'm going to clamp off behind and push another 0.4. 1, 2, 3, and 4. And open it up and let it flush. And the whole time I'm pushing the medication, I am observing my patient for any adverse reactions, any closing of the throat, any swelling of the eyes, any signs that they may be allergic to the medication, and also the signs and symptoms of digoxin toxicity as well. Alright, back at 12, clamp. 1, 2, 3, 4. And open it back up. Alright, my last interval, I will clamp down and push my last 0.4 remaining of medication. And open back up and let that flush through for a minute. Okay, when it's finished, I will take off my syringe. I'm still monitoring my patient. I will discard of my syringe and my needle in the sharps container. And then I will monitor my patient. I will monitor their labs, especially for any signs of digoxin toxicity. And then I will also document in the MAR. So I'll document the medication that I gave, which was Lanoxin, the amount, which was 0.2 milligrams. I'll document how my patient tolerated the procedure, the route, which was IV push, and the patient's name, and that's all.